I want everyone to smile for me. It's good to see those smiles. They did a study a few years ago because they believe that if you smile, you actually would take in information differently. But they had to do the study to figure this out in a way that people wouldn't know if they were smiling. And so they did it, they called it a divided attention study. And what they did is they said, we want you to evaluate this material, but in doing so, we want you to do it with a pen between your teeth. And when they did, they naturally engaged the muscles of the face that involve smiling. And the other group, they said, we want you to do the same study and look at the same material, but what we want you to do is hold the pen between your lips, which inhibited the muscles for smiling. And sure enough, the people who were smiling, even though they didn't know they were smiling, rated the material as much more positive. So everyone give me a nod. So they did another study that showed items that were coming on television, a television set from top to bottom. So as they were watching the items, their head was going this way. They rated those as higher than if they were going from right to left and they were going this way. So if you smile and nod occasionally, you will enjoy this a lot more, and I will enjoy it a lot more. They did a study in 2014 on trauma patients, a man named Steinhausen, or a woman named, actually, an investigator named Steinhausen. And they stratified the patients into the high outcome group and the lower outcome group, the people that did really well and the people that didn't do so well. And they asked the question, is there someone living with you at home? And they found that if you had someone at home living with you, a spouse, a partner, the chances that you would be in the high outcome group were 3 times higher. And they went on to ask some other questions. They said, in the care of your physician, did you feel that your doctor made you feel at ease? Was he understanding of your problems? Did your doctor treat you as a whole person? Did your doctor show care and concern? Do you believe that he helped you formulate a plan to control your own health? Was he positive? Was your physician positive? And they had you rank those from 1 to 10. And they showed that the physicians that had high, they called it high empathy, were from 80 to 100. Those were scored medium empathy from 60 to 80. And below 60 or below was low empathy. If your physician showed care and concern in the medium empathy category, your chances of being in the high outcome group as a trauma patient were almost 5 times higher. If you had a physician who showed you high empathy, was very concerned, you felt they really cared about you, the chances of you being in the high outcome group was 18 times higher. And with that kind of information, the fact that your care and concern, your physician's care and concern, I believe it's also, we can extrapolate this to nursing care, to technologists, to anyone who cares for patients in the hospital. I believe even for people who care for people at the home, that there's something about that empathetic connection that actually helps the immune system heal. I want to talk about some ways that we can have more empathy. A researcher named Helen Reese wrote a paper, and she used a mnemonic, and I will borrow some from her mnemonic of empathy. And the first thing that we can do when we come in the patient's room, the E stands for eyes, to look a patient in the eyes, to look a person in the eyes. And I do that actually to the point that I notice their eye color. That means I've really looked into their eyes. And the eyes are the window to the soul. There's something about looking into a person's eyes that makes them feel that you care. Obviously, many of us walk into a room and the first thing we look at is the computer, which we have to sign on, and otherwise it's as if we didn't even show up. But remembering to look that patient in the eyes as often as possible is very helpful. So the M in empathy, it stands for motivation. When you're with a patient or you're having a discussion with a member of your family, what is your motivation? For many of us, when we first start a job, our motivation is to learn the job and to enjoy the job. But after 2, 3, 5, 10 years sometimes, our motivation often is to finish so that we can go home. Or the paycheck or something. And we forget that, boy, so much of life is spent at work. So much of life is spent with these people. Am I contributing something valuable to them? The other mnemonic for M is mirroring. Oftentimes when we're in a relationship, we naturally mirror the other person's emotions. Some researchers actually at UCSD have found mirror neurons in the brain that actually allow you to naturally mirror someone. If they are sad, you want to be sad with them. But as a healthcare worker, oftentimes we don't allow ourselves to mirror our patient or our coworker's emotion. And so we don't always empathize well with them. Noticing what the expression of their face is and mirroring that and not trying to always make them happy, but actually validating their emotion is a very powerful, empathetic response. The P in empathy. The P is for posture. What is my posture? As we talk to patients, we know that if we sit down to talk to a patient, their perception is that we've been in the room longer, the studies show. The perception is that a physician or a nurse, I would imagine, who sits with a patient it's as if we've been there longer. Do you have a dominant posture as you're speaking to your patient? Certainly an angry patient, can be a very unsettling thing to go through. What is your posture when a patient is angry? Do you act defensive? Do you sort of stand up? Do you cross your arms? I think the first thing in handling an angry patient is that we need to manage our own emotions. Angry patient or an angry person, manage your own emotions. Be cognizant. What's happening inside of me? Don't react too quickly. Show concern. If they are angry, obviously something is bothering them, and our initial response is usually to be defensive. But what is called for, what is empathetic, is actually showing concern. What is it that is bothering them? Or maybe a better question, what's really bothering them? They've been waiting to see me for a long period of time. when the nurse says, "Doctor, this patient is angry," I know that I need to settle myself down. I need to take my own emotions into consideration. An angry patient, I need to look them in the eye, validate them. Wow, it seems like you're upset. You've been waiting for a while. I can address their concern. I can give an explanation that's not necessarily defensive. And then I can apologize with a humble but confident body posture. I'm so sorry that I caused you to wait for me. Most people that are angry with you, they want to be validated. You have cost me something. You've inconvenienced me. They just want to be validated. You don't have to be defensive. By being defensive, you're actually escalating the situation. By apologizing to them, saying, I'm sorry, what can we do now? Let's go on from here. I'll give you the time that you need. So the P in empathy is also a bit about pain. The patient that you're seeing is going to have some pain, but their pain may also be more than that. Because most of us, including the people in this room, also have not just some physical pain, but also relational pain. I think if we took a poll, most of us have at least one relationship in our life that's not going that well, that probably bothers us or keeps us up at night. What is happening in your patient's relational life, maybe their financial life? What is it that's really causing them pain? Because we know that most of the people that come to see a doctor, probably 80% of those, there is some overlay. There's some relational, social, emotional problem that is also causing their illness to exacerbate or to be worse or to flare up. And so addressing their pain is to be emotionally empathetic. Many of us don't understand what overwhelmed cues look like, what it is when a patient is overwhelmed, or even when we are overwhelmed. It can be as simple as a little laugh. It can be diverting the gaze. It can be a tear, glassy-eyed. You see, even in our relationships at home, oftentimes we don't respect people's signs of overwhelm. It's very common among women that are trying to get across a point to their husband who now has looked away or become glassy-eyed. The solution, she believes, is to raise her voice and shout even louder. That is going to help communicate this very important truth to him. But once someone is showing the signs of overwhelm, they are no longer receiving information. What it's time to do is to calm down, and we're going to need to pick another time, another opportunity. When can we discuss this further? Because it's pretty clear that you're not receiving anything anymore. And what happens when you continue to push your ideas, yourself, your emotions on someone who is overwhelmed? What that feels like is that you don't understand me and you don't respect me and you're not protecting me. And I'm actually going to lose trust in our relationship. That's what happens when we overwhelm people with our emotions. And it happens with parents and children all the time. Parents believe if they yell at a child who's looking away or not paying attention, that is a good thing to do to get the idea across. Well, it certainly makes the parent feel like they've gotten the idea across, and the person yelling somehow feels better, but what it does is actually destroy the fiber of the relationship. The trust is going to break down. You obviously are not understanding where I am and that I'm overwhelmed right now. and you are not able to get your emotions under control so that we can have this talk another time. The first thing that we need to do in most of our relationships is to manage ourselves and our own emotions, and to know when we are getting overwhelmed and when other people are as well. Overwhelm is very common in our society because we have so much information coming at us. Things that people may not notice cause them to be overwhelmed is things like traffic. Having a conversation, a difficult conversation with someone, having to say something to someone who doesn't want to hear it. This can cause overwhelm. We know by studies of willpower and self-control that having a conversation with someone and you're not sure how they're going to react, it costs you a lot to have that conversation. And if a nurse has a conversation with a patient or with a doctor and it becomes a difficult conversation, we need to make a mental note of that, because later on, if you're going to try to have another one of those conversations with someone else, it's going to be very quick that you will get overwhelmed. And if you don't recognize that about yourself, you're going to walk into situations and you're going to say things like, I can't believe that I said that. I can't believe that I did that. I can't believe that I started crying or that I started yelling. And you're going to wonder, that wasn't like me. I can't believe that. But you need to watch your own overwhelm cues and what is costing you. Suppressing emotions can also cost you and make you be overwhelmed. And as people who work in healthcare, I know working in the intensive care unit, I will come out of a patient's room and they're on a ventilator and things are very sad, things are going very poorly. And I come out of the room and I go to the nurse's station, and one of the nurses wants to tell me a joke. And she tells me a joke, and I'm laughing, and I catch out of the corner of my eye the family that I just talked to. And so I suppress my emotions. I'm not supposed to be happy because something sad is happening for them. And we know from the research that when we suppress our emotions, it costs us. It costs our self-control. It costs our margin for overwhelm. Whether we're suppressing happy or sad emotions. And dealing in healthcare, many of us do have to suppress sad emotions as well. We can't cry with a crying family because we need to keep ourselves together to talk to another group. So monitoring your own sense of overwhelm, your own sense of where you are and how much you're giving